careful because I'm sitting between our sassy senior and our wild senior over here. Okay, yes they are. I'll talk to you after the show. Yes. When we get older, sometimes your body just can't handle the physical things that you used to do. Even younger bodies can only take so much, but a new treatment makes it easier and faster to heal. Pro athletes like basketball player Kobe Bryant and golfer Tiger Woods have used it. Dr. Adam Weglein with Regenerative OrthoMed Institute explains what the procedure is and how it helped patient Marlene Simmons get her life back on the fairway. Marlene, it is not only scary, but it must be very frustrating to go from being this top athlete to all of a sudden just almost bedridden. Tell folks at home what kind of life you used to enjoy.
Well, I've been in sports most all of my life, and I've played golf for many years, and when I...
Yeah, you didn't just play golf, you won awards for playing golf. Yeah.
I have enjoyed some success on the course, so that was exciting, and I had some issues health-wise and ended up injuring myself, and so when the thought of surgery was kind of overwhelming to me because I know the recovery and
yeah, and especially with typical surgery, Dr. Weglein, that a lot of people sometimes don't do as well as we would hope because scar tissue, once you start cutting in traditional surgery. And so what was the issue that she was dealing with that was just kind of slowing her game?
Yeah, she basically had two concerns medically. One of her shoulders had a tendon tear and arthritis, as well as her hip also had a tendon tear and arthritis.
Sounds very painful.
Yes.
The pain wasn't as much to me. It was funny when we discussed when I came into the office, the pain wasn't so bad. It was whenever I would take the club to the top of my backswing, my shoulder would pop out. And it was kind of frustrating more than anything. And but I'm sure it was quite painful, but really the frustration was more a problem than the pain. So
okay, so she had two issues like you were saying.
That's right.
And so what's the plan of attack? What was the traditional way of dealing with it, and how did you deal with it?
Sure. Traditionally, some of these may be considered surgical at some point. Sometimes people think about cortisone shots or hyaluronic acid injections for arthritis cases, physical therapy, but there's a new procedure called Platelet Rich Plasma PRP. It's a fantastic procedure that helps for arthritis and tendon issues as well, all over the body, anywhere from the neck, shoulder, rotator cuff, like the golfer's or the tennis elbow cases, hips, knees, ankles. It's fantastic.
How does it work?
It's a beautiful system because it's actually using the body's own ability to heal itself. We take a part of the blood, it's called the platelets, spin it down in a centrifuge, and in the office we have a fantastic centrifuge. We use a cytometic system, which allows you to actually take a part of this platelet portion and actually titrate or create a platelet product specific for the patient. What I mean is, if you have a 15-year-old, it's a very different injury than a 91-year-old. And with this system, we can actually make a specific product of platelets that help in that process. Now, what do the platelets do? Platelets are kind of like the construction workers of the body. If you need to have something built, whether it's tendons or cartilage, the platelets come. Like, for example, when we're shaving, if we have a little nick on our face or on our legs, how does that get healed? It's through platelets. So we take the same mechanism of healing and just concentrate it and inject it back under ultrasound guidance into the body.
So it's regenerating.
It is regenerating, absolutely. And it's not blood doping. Some people get confused with that.
Right.
Blood doping is not legal, and blood doping involves the red blood cells to make the athlete perform faster and stronger. This is not at all. This is to help the body heal, not to perform faster.
What patient qualifies for something like this? You talked about different parts of the body, but what state do they have to be in, and what's an indication that perhaps they need to come in and consider this?
Sure. Anybody from the teenage years into the 90s, I have a large patient base that fluctuates between these three ages, and anything, again, tendons, ligaments, arthritis cases, and if they're thinking, listen, I'm not quite sure if I want to go to surgery or if I need surgery yet, but I want to look at something that's a little bit on, cutting edge, so to speak, that's non-surgical, and something that's done right in the office. There's no anesthesia or IV. This could be a good option to consider.
And you mentioned something I think is very important earlier, and that is that sometimes people do the injections. That if you're still doing your motion, if you're taking painkillers or injections, you could be causing more harm than good, right?
That's right.
So it would make sense to come in and see exactly where you really stand in terms of the injury and how you can get that fixed. So basically, she's good as new again?
Almost. She's been doing great.
Yeah.
Actually, it's interesting when you're talking about the labrum was torn in the hip, and so we ended up doing the hip as well. And it was interesting whenever he told me, he said, well, it kind of acts like glue, because I didn't quite understand it. I was a little bit reticent. I explained to him about this procedure because it was a little bit new, but it literally did act like glue. And it just glued it back together, and I have never had any problems with my hip and my shoulder.
So you got your
since then.
swing back.
And it took me about 6, he said, give me 8 weeks. I said, I have 6. So we did, did a little bit, 6 weeks.
That's
I was working at it, and it really, my recovery time was so minimal compared to my friends who have undergone surgery to repair.
Right, and
this
friends
type of
who
thing.
undergone surgery might not ever be back to full speed again, and you're much closer to that than they would be.
And the thing that, which you were bringing up, Deborah, is so true. He did explain to me originally, he said, if we do this now, you're a good candidate. But if you wait, it's going to continue popping. It's going to continue tearing. It's going to continue tearing.
Start getting into replacement territory, right?
And then you won't have any choice but to have surgery.
Yeah.
So that was, I thought, was a good point. And my husband said, Marlene, if you can avoid surgery, try it.
Yeah. So the minute you realize that something is chronic, you need to get in, have it checked out, figure out what it is, and then know what your options are.
Absolutely.
Dr. Weglein, thank you very much. Marlene, thank you. Is that sterling silver? Oh, yeah.
Dates back to the 50s.
Oh, that's, silver's up now. Yeah. Okay. Thank you very much. There's her golf trophy. If you're suffering from arthritis, tennis elbow, ligaments, or tendon tears, find out more about Platelet Rich Plasma by logging on to HoustonSportsDoctor.com, HoustonSportsDoctor.com, or give the office a call at 281-888-3416, 281-888-3416. Whether you're 17 or 70, emergency treatments have relatively been the same for everyone until now. How one hospital system is focusing on specialized care for seniors after the break.